proximal radial ulnar joint.
Very good. So with the proximal radial ulnar, the radius to the ulna, we have a convex outer ridge of the radial head that's going to be going and articulating with a concave ulna. So the convex concave rule comes into place. When the forearm goes into supination, we also have a ventral glide along with the rotation that takes place. So to enhance supination, I'm going to do a ventral glide of radius on ulna. And that takes place by getting the patient's humeral ulnar position at its open pack position of 70 degrees and the radial ulnar position in its open pack position of about 35 degrees of supination. I put my thumb onto the joint line. My cranial hand is on the joint line. My thumb is at the joint line, and I'm going to stabilize humerus. I'm going to come down with my other thumb into the caudal dimension, and I'm going to take the thumb onto the radius, and I'm going to push radius into this position. I'm also going to have my thumb come down from that position onto more of the ulna and radius so I can feel that movement. From that position, I'm going to go ahead and do a ventral distraction, ventral glide, I should say. Ventral glide. Going in this direction, it's going to enhance supination. Conversely, with pronation, the radius translates in a posterior direction along with rotation. So I'm going to be in the same position, take up the slack, and I'm going to pull him in a posterior direction. The radial head taking up the slack and pull in a posterior direction. Okay? Ventral, posterior glides of the radial ulnar joint.